Good morning, everyone. I'm so glad to see you all here today. Whether you're joining us from your office, your home, or out in the community, welcome to the Early Learning Advisory Council meeting. Just some quick virtual meeting protocols. And then before we jump in, just a quick housekeeping note. Please take a moment to update your Zoom name to include your role. So if you're an ELAC member, a regional advisor, or a guest, so we can keep things flowing smoothly, please. And then let's kick off things with some light connection in the chat. Go ahead and drop your name, where you're joining from, your role, and just for fun, what's one thing you're looking forward to this summer? And I will go first. My family is going to go to Mexico for my cousin's daughter's quinceañera. So super excited to get to spend some quality time with one of my aunts whose love language is food. So she's also my favorite. And I will just give y'all some time to drop those in the chat. I'm loving all the comments. Thanks for engaging. I'll give it about another minute and then I will move on. All right, thanks y'all for your engagement. Let's move on to our ELAC committee business. First, I want to acknowledge the candidates who stepped up for the co-chair role. So thank you for your leadership and willingness to serve, Dr. Brian Knowles and Laura Murphy. There is currently only one vacancy on the ELAC executive committee, and it's for co-chair. This morning, our ELAC members heard from both candidates and cast their votes on this position. So just a quick reminder, if you haven't voted yet, please make sure to do so before the end of this meeting, hopefully before our like noonish break. That way we can share the results at the end of this meeting. And that link is in the chat. Thank you, Jessica. Next, we'll take a look at the meeting minutes from last time. Hopefully you've had a chance to review those. They were emailed out for your review. And they're also in the chat. So I will give you a couple minutes if you haven't had a chance to go over those. And then if there's any questions or changes needed before we move to approve those. All right, are there any questions or changes needed before we move to approve those meeting minutes? I don't see any hands raised, nothing in the comments yet. Okay, I will move then to approve those meeting minutes. Can I get a second?
I second.
Thank you. And all in favor?
Aye.
Aye.
Aye. Aye.
Aye.
Aye.
Aye.
Aye.
Aye.
Aye.
Thanks, y'all. We catched some of those thumbs as well. Appreciate that. So motion to approve the meeting minutes has passed. And then we will also check in briefly on a few standing items like the state agency partner updates document, the regional coalition updates doc, and then the feedback loop doc. I'll pause after each of these to give space for questions or comments. Feel free to come off mute or drop your thoughts in the chat. So first one being the state agency partner update doc, which the PDF is in the chat. So I will give you a couple minutes, or if you already have any questions, feel free, like I said, to come off mute or drop in the chat.
Ruben, I see you have your hand up.
Yeah, I just want to make one correction on the committee business. It states that we will have in-person childcare committee conversations in Pasco, and we recently changed that to virtual meetings at the request of providers. So those childcare conversations will be virtual.
Thank you for that, Ruben. Any other questions that are popping up from anybody? I know it's a lot of information. There's a comment in the chat. It says in Snohomish County, we have been hearing that military families are on long wait lists for childcare. What is locally happening to support military family access to childcare? Not sure if Olivia can answer this. see your hand up, Rep. Go ahead.
Yes, thanks for the question. It wasn't asked to me, but that's okay. I'm going to answer part of it anyway. We've been working quite a bit on childcare surrounding military bases, in particular because 1 in 5 Washington military families are food insecure, and having that second income is critically important. And childcare has been a significant barrier. The waiting list, for example, at JBLM, which is the district where I represent, is pretty long, and there aren't enough slots. And have toured that with fellow legislators and others. We passed a bill this session that allows broader access to childcare for military families and home-based care. So that's number one. And that allows, it's still under the jurisdiction of DCYF for complaints and abuse and, concerns and investigations. But it broadens and provides more flexibility. In addition, we also did one that really focuses on removing the barriers to childcare in HOAs. We did that a couple years ago, and so banned HOAs from prohibiting childcare in home care settings. And then there is one other one. Well, another bill that we passed this session that really focuses on zoning. We found that some jurisdictions didn't even realize how bad they were. Lakewood in Pierce County was one of them, as was Pierce County. And so recognizing and changing zoning requirements to allow more childcare facilities and access to childcare homes in broader areas of cities and county jurisdictions. So I think those three combined, the childcare one specifically for military families and childcare homes near bases, will certainly address the Snohomish County question, but certainly across the state, any locations near bases will have more home care access, provided that they're, of course, providers to do the work, which is why we need to pay providers better. But having said that, I think those will help, and all of those were passed. The zoning and the home care one, in particular, those two were passed this year, just about a month ago, and both signed by the governor. So those go into effect in July, of course, the 90 days after. So, but I think that will really help, particularly the one on home care near bases in Senator Riccelli's bill.
Thank you so much for that. All right, I haven't seen any other hands up or any other questions in the chat. So we will move on to the Regional Coalition update doc that is now in the chat. And again, I will give you a couple minutes, and then feel free to come off mute or drop those questions in the chat. And Courtney did drop those two bills that Rep. Levitt mentioned, if you're interested in looking at the language. I'm not seeing any questions in the comments. No hands. So we will move on to the feedback loop doc. And again, if you have any questions, go ahead and feel free to come off mute or drop those questions in the chat. Not seeing any questions in the comments. Not seeing any hands up. Please know, we know that it's not a ton of time to go through, so if you come up with questions after the fact, please feel free to email us and ask those questions so we can get them answered for y'all. I will pass it over to Colleen.
Thanks, Dre. I believe, oh yes, I see Jennifer's here. I was just checking to make sure that our presenter was on before I went ahead and introduced her. Today we are going to have a presentation with Jennifer Helseth, and I hope I'm saying your last name correctly, health systems analyst who will provide ELAC members an update on the role of the childcare health consultation and the value of immunization registry access in preparing for vaccine preventable disease outbreaks. The presentation will cover how health consultants support providers, how to access immunization records, and ways to strengthen outbreak response plans. As a reminder during the presentation, please type your questions or comments into the chat box. Once the presentation is over, we will answer all typed questions as well as open it up for additional questions for the presenter. Thank you. And I'll pass it to you, Jennifer.
Awesome. Thank you. Good morning, everyone. It's been a while since I've had the opportunity to present to y'all. I'm Jennifer Helseth. I'm health systems analyst. I sit within service continuum team, which means nothing other than that I'm actually outside of the licensing structure. But I have the opportunity to act as a resource and as a support in the public health field to our licensing and early learning providers. So what I'm going to speak with you, I love how important all of the things that in my introduction sounded, and hopefully I can live up to that. But I really would love if you guys have questions as we go. I know you were told to put questions in the chat, and that's great if that's how you're comfortable. But if you have something that as we go, I have 4 separate topics we're going to go through. So it kind of makes more sense to kind of answer questions about each topic as we go versus getting to the end and then having it be a little bit confusing. So please feel free to jump in. If you have any questions, raise your hand. Take yourself off mute. I'm pretty good at watching faces to see if there's anybody who wants to jump in, for the few that I can see at least. So I have overseen for the last 8 years the Child Care Health Consultation Program for the state of Washington, which is what I have come to speak with you in the past about, although it's probably been a good, well, it was pre-COVID, probably the last time I was there. So it's been a good 5 years or so. But child care health consultation is something that, as most of you are probably aware, has existed in Washington state for more than 40 years. And in the past, it was supported by the Washington State Department of Health. And then as public health philosophy moved away from direct services, it kind of got farmed out to the local health jurisdictions. And then as the nurses who were working in those positions retired, most often what happened was those positions just weren't filled. So there was a little bit of a gap in support for child care health consultation, both for the child care providers as well as for the nurses doing the work. So when I started back in 2017, it was something that that I picked up as a whole that needed to be supported. So I have spent the last, what's that now, almost 8 years, almost 9 years, whatever. I don't know, I'm a little off on my time here. Trying to build that up. And one of the biggest concerns that I heard from childcare providers was really that it was hard to find nurses. And so I've spent a lot of time coming up with training and doing, I train probably 4 to 5 nurses a week across the state. So it's a good number of nurses. I have nurses working in every single county across the state now, which when I first started, I think we could account for about 40 nurses across the whole state, which if there's every childcare center that serves infants needs one, that obviously is not enough to serve the whole state. And I understood why there was a problem. Now I have about 300 nurses across the state working in childcare health consultation, and those are the ones that I can account for. So typically what I like to say when I'm speaking with childcare providers is that we are in the process, of course, I've been saying this for years now, but we are in the process of creating a registry which would allow childcare providers to not have to contact me directly to be able to find a nurse, because that makes me the weak link. Currently right now, I am the system and I am not a system, I am a person. So we have I think I have the ability to share. So I'm going to share the page currently. So this is currently the page. Let's see, is it coming up? All right. Okay. Are you looking at? Yes, good. So this is on the DCYF webpage. This is the Child Care Health Consultant page. This has information on how to submit monthly reports, which is a requirement for each of the nurses doing this work. It has a brief explanation of what is expected of a child care health consultant, as well as the services that you can expect to receive as a child care provider. Additionally, there's really some really clear resources in here. There's a 1-pager about what is childcare health consultation, especially if you have a nurse who you're interested in bringing in to be the consultant for your center. They need to talk to me first. We need to make sure that they're registered and that they've had some basic training. There is an online training here, Childcare Health Consultation 101, which I think is also phenomenal, not just for nurses, but also for childcare providers, so that you have the opportunity to, once again, to see what you should be expecting from your childcare health consultant. Because the thing that I found the most over the last year is that when a childcare provider feels that they're not getting good, that the service is not worth the money that they're paying for it, it's typically because they haven't had a provider or child care health consultant who's offering, thanks Marlene, who is offering the services. So yeah, I have a handful of links that I'll throw in there, or Marlene is quicker than me. Fantastic, thank you. But at any rate, this is a great place to start. There's some sample contracts, there's some sample monitoring forms. And one of the things that we know, and this is from some research across the state, is that, as well as across the country, centers that have a integrated and trained childcare health consultant have healthier centers. They have centers where children aren't getting sick as often, that their infant rooms are there. I could expound upon it, but it's all on this page. So I just want you to see that. If you happen to be in King County got a grant through their Best Starts for Kids program to get their registry up and running. So ours will not be as fancy as this because they had like $1 million to do theirs and I have $10,000 to do mine. But I want to show you what their registry looks like. So if you are a provider in King County, you can go to this web page that comes up, find a King County Child Care Health Consultant, and they're doing theirs. I had the opportunity to sit on the group that helped develop this. So it really is going to do exactly the same things that our registry will do eventually, which is separating out geographically, especially like in King County. I think I have 30 childcare health consultants working in King County outside of the health department. And I have them separated out geographically because somebody who's working in North King County might be willing to serve Snohomish, but they're not going to drive all the way down to South King County, whereas somebody in Pierce County might be willing to go up to South King County, that sort of thing. So this is a fantastic resource for those of you in King County, as well as a kind of a sneak peek, perhaps, at what we're hoping that ours is going to look like. How do I collaborate with local health departments? I work with every health department that has staff who are willing to work with me. So I sit on the childcare health, what's the word I'm looking for? The councils that support childcare health consultation for both Snohomish and King counties, which are the two that currently have funding to support a team to support childcare health consultation or childcare health broadly. Several other counties, including Island County and Pierce County, have staff that now are receiving funding through other sources within the public health department. And there's one in the Tri-County area on the east side as well. So Adams, over in that northeast side of the state, who also are looking to try and support childcare providers a little bit strong, in a little bit more, I'm having a hard time with words this morning, I apologize, a little bit more authentic and stronger way. And so all of those I have the opportunity to consult with, and I am also available to all of them through Department of Health has communities of practice with the local health departments. So I present at those fairly frequently as well. So I am always around and as a resource for them. Did you have something specific that you were looking for, Lois?
Hi, Jennifer. No, I just thought it would be good to be able to share out so
Oh, yes.
everyone knows.
Yeah, thank you, Lois. I appreciate that. It's nice to see you again. It's been a while. Okay, so before I move on from childcare health consultation, does anyone have a specific question or wondering about it? Because I'm talking really fast. I acknowledge that I wasn't expecting to be done with this 4 minutes, although I guess I started a little bit early too. So I'm going to be good at giving us some space for everybody to think for a moment if there's anyone who has a question.
Hi, good morning, Jennifer. I'm curious, do you all consider the mental health piece? So is it just consultation regarding the medical health, or is it mental as well?
That's a fantastic question, Brian. Actually, yes. So we work regularly with the infant and early childhood mental health consultants. However, this specific WAC requirement is only for nursing services in infant rooms. So it's kind of a subset of a subset. All of them broadly are considered childcare health consultation. And ideally, in a perfect world, we would have both services along with others to offer to every childcare provider. We know that that's not the case right now, especially not in our fiscal situation, right? But generally, if it's something that if you're looking for a specific service and it's not one of the nurses, I do have contacts to be able to connect you to those services if there's something else. But this specifically is medical health, is around physical health. We have home-based providers who might need this service but will not have funds to pay. I wish, and every time I give a training to any new nurse, I give them my soapbox that says that it should be a free service that's available to every childcare provider who has any desire for it. both licensed family, friends, and neighbors. Everybody should have access to somebody who can give them good health advice or environmental support in their centers. Unfortunately, that is not the way our system is set up. All of the nurses who do this work are independent consultants or are held or paid by the local health department. In King County, they offer services for free to childcare providers who are part of the Seattle preschool program. But beyond that, all of the nurses charge for their time. They are always willing to do the services for people, even those who are not WAC required. So we do have some family homes who receive like not monthly visits necessarily, but will receive like a quarterly visit or something like that from a child care health consultant to be able to just for peace of mind or for their own comfort, or to solve an issue that they may have had. But unfortunately, there are no nurses who are doing this work for free right now. Hey, Astrid.
Yeah, hi, Jennifer. It's Astrid Newell from Department of Health. Thanks for being here and for spreading the public health message. Curious about the role of the child care health consultants around development and developmental screening and developmental assessments. Now that's certainly an area that Department of Health is working on, and ties in with Ryan's question as well around just the mental health and healthy development.
Yeah. Thank you, Astrid. So what I will say is that many of the childcare health consultants are trained in how to do developmental screenings. It is not part of a childcare health consultant's role to do developmental screenings. The way that childcare health consultation, this is the training that I typically will, what I start off with when I'm talking to a nurse, is that when you're thinking about childcare health consultation, the children are not your patients. They're not your clients. The center, the location is the client, is the patient. And yes, and I would say with an asterisk, right? Like the reason we hire nurses to do this work is because they're coming in with a set of skills and the eyes and the knowledge base of someone who is a nurse or a healthcare provider, that sort of thing. But they're not there to treat, diagnose, or do anything with the children unless, and this is where that asterisk comes in, right? Unless the childcare provider hires them to do so. So like they can do it as an add-on, and many do. They'll do add-on trainings for staff, or they'll do add-on developmental screenings, or they'll do add-on sensory screenings, meaning hearing, vision, weight, height and weight. But it is not officially part of the services that are offered by a childcare health consultant. And then Debbie, I just wanted to follow up on your question about the services through the public health. So Snohomish Public Health Department is the other county that offers childcare health consultation support. And they have 2.5 FTEs for the entire county that are paid for through their general fund. So they're always at risk and they're always in a little bit of a turnover space. They do not actually specifically offer consultation. They offer support to connect to consultation or to consult to the consultants, that sort of thing. So most of the work that they do is they have a fantastic LMS with health trainings. That's free to any childcare provider or consultant. So if you are in need of any sort of health, that offer stars hours and those sorts of things, if you're in need of any health trainings, their LMS is fantastic. Their online training program. And they also are fantastic. Misha Horn is their environmental health person at Snohomish County. And she is, I've known her for 20 years now, and she is one of the most knowledgeable people in this field that you will ever meet. So fantastic supports, but they are not in fact offering direct consultation for childcare providers because they just don't have the capacity to do so.
I just have a follow-up question, which I know the team, I just want to say they're amazing and we so appreciate them.
They are so amazing, yes.
I wanted to ask you, is there a model out there where maybe smaller providers pooled together to hire a nurse consultant, or is that allowed?
Yeah.
Yeah.
Yes, Debbie, that's a great question. And I will say, yes, there are models. In fact, pre-COVID, before everything kind of fell apart in our world, we had put together a plan that would allow us to kind of do a co-op kind of system in much in the way that like the ESDs do for school nurses for smaller school districts, so that they're hired by an outside entity that then you can kind of buy into the services, you know, through your portion, or you could go in on the costs. Um, the So yes, there are models. Do we have any currently in Washington? No. Am I aware of any other states that are doing this? No. Has there lots of discussion around it? Yes. So I think that if we could make that happen, in fact, the legislative reports that I've submitted on several occasions have suggested just that. We just have to be in a place where we can afford to pay for it. So if you are wanting to talk about it, I would love to chat with you about how that could work potentially. Laura, I'm sorry.
Hi, I do a lot of work around, early intervention and mental health supports for kids. And our local ESD 105 did exactly what you're saying. They hired a nurse. I mean, they hired a behavioral consultant, right? And she's really been beneficial to us to be able to link kids with ESID services and get that wraparound support for them. And we have seen um, huge success with that. But when she first opened, it was a grant that they're operating under. And, she was begging for clients, right? So of course they came to me and said, hey, would you, would you be willing? Do you have some kids that need services? To now there's 4 therapists and, they're running a wait list. So, and that was only like a year and a half ago that they started this. So I mean, there's a huge need for early intervention. And maybe also I was wondering if there's any work around training providers to provide ASQ screenings, right? That could be a way that providers could recognize, which kids need services and a resource.
Yeah, I thank you for that, Laura. Yes, hopefully I'm not frozen because everybody else looks frozen all of a sudden. Okay, I don't know if I'm back or not. Can y'all hear me?
Yeah, you're fine.
Yeah, we can hear you.
I was gonna say, I can't tell who's if I'm frozen or other people are frozen. So yes, there is a, or has been, I don't know how it's sitting. Sorry. There's somebody at my door. I don't know where that's sitting in the funding side of the world at the moment, but there has been, at least for the last many years, a training program for training providers on how to do ASQs. And I think that that's something that there are enough people around that if there's interest in that, then I'm sure that would be something that can happen again. I apologize that my dog's barking. The other part of your question was around the co-op work that's happening at ESD 105 around early intervention. And Ava, thank you. Thank you. It's just the neighbors. Yes, we have one of the ESDs who is supporting us, and that's actually the ESD down in the Tri-Cities. And that's because we couldn't find nurses to do the work in that area. And so I contacted the school nurse corps, and they were able to hire a nurse who's doing all of the childcare health consultation work in that area that we need. So we've been very lucky that they took that burden on, and they are charging for the services because obviously the ESDs have to make money as well, or at least cover their costs. And the early intervention is an interesting place because, again, like I was saying, early intervention services, yes, they do. The early intervention services really fall under our ESIT team as opposed to like childcare health consultation. And of course, there's a role in where they overlap. But like I was mentioning, childcare health consultation really specifically is looking at the environment and how do we ensure that the environment is the healthiest, safest place for infants in care, as opposed to the actual developmental needs of the children. And they play a role in that, like they have their developmental knowledge to be able to say, this child, the example I generally give is if you're in a classroom and you're doing observations and you see that there's a child that you've been told is 9 months old, and you know from your own developmental knowledge that they should probably be sitting up by now, like that's outside of the developmental norm. It gives the nurse the opportunity to chat with the providers about, do they need words to talk, do they need support around talking to the parents, maybe they tried and they weren't being heard, or those types of things, but from that like clinical standpoint, as opposed to the place that many of us in childcare sit, so that's kind of where that crossover lives. And I don't know if, Nicole, do you know anything else about where like the Find program or any of those programs that Roxanne was running, are any of those still in existence?
Yeah, thanks, Jennifer. Some of those are still in existence, and we are planning to still do some ASQ SE training. I will just acknowledge, as we're looking at some of the reductions in funding, that we're evaluating where those dollars go at this moment.
That's what I figured you were going to say. Thank you. Okay. Yes, so there's one more question, then I want to move on to the two other things, and we can always come back to this because this is the biggest part of the topic. But there was a question from Lois about, do I know if Seattle has included money for mental health consultation in the upcoming education levy? And to answer your question, I have no idea. I hope that they have. They have several mental health specialists that work on their team. So I know that there is a strong support and interest in it, but I don't actually know if it's in their education levy or not. So if you find out, be good to know. And I don't want to cut anything short, so I'll give everybody a second to see if there's anything else that it's on top of mind. And again, I don't expect any of you, if you have a question, to feel like you need to talk right now either. I will put my contact information in the chat. And if you have a specific question to your center, to your location, I'm always happy to kind of problem solve with people as well. That's a huge part of what I do in my job. Okay. All right, so related and yet tangential, immunization access has been, for the last 25 years, has only been through a medical provider. And then as of a year ago, November, we were able to get the law changed so that childcare providers have the ability to access the immunization registry without a medical provider. So we had originally run a pilot for about a year where we were utilizing childcare health consultants or public health nurses to be that conduit. And that was great. It worked really well in the places that we were using that. Yes, thank you, Sandra. And one of the things that we really knew was that there was not capacity from anyone to be able to hold that number of childcare providers. So thank you, Dre. And Courtney, yay, see all of these people that I know, you guys are all using it. It's fantastic. So the registry now has an ability for you as a childcare provider, whether you have a consultant or not. So this is now accessible for everyone all the way through school age, to access the immunization registry through a limited share agreement, I believe is what they call it. But I will pull up the page so you can see what you're looking at. And then I'll put the website in the chat. So the immunizations, there's a school module and a childcare immunization module. It used to just be called school module, but now that childcare providers are able to utilize it as well. So there's fact sheets, there's PDFs, there's slideshows about how to do it. But then the important part for you all, or as you're talking to folks, is getting access to the immunization module. So this will walk you through, let's see, this one, the limited exchange is the one that is available for childcare providers. And it will, stop sharing because there's nothing else you need to see on there necessarily, but yes, it was something that we were not able to do because of RCW, and it was a holdover. Other states had gotten to the place where they weren't requiring nurse access or medical access, and we were unable to change it because of RCW, but we were able to get through lots of pushing and lots of discussion with the AAG's office, we were able to kind of maneuver around the RCW to be able to make it accessible for childcare providers. So I put the link into the chat. I highly, highly recommend access. Every childcare provider across the whole state, all 5,000 plus of them, have the ability to access this system. And what it will also do, and this is one of the things that over the last decade we've been working on, is really trying to improve the number of childcare providers who are reporting on the annual immunization status reporting, which happens in the fall. We are mandated to do so by WAC. And yet when I first started, there were less than 10% of providers who were reporting, and we've gotten it up to about 25% now. And one of the reasons I bring that up is I'm happy to help you report if it's not something that you're currently doing. And I will also say that if you're using the school module, not just pulling immunization, not just pulling the CISs out of the system, but if you're utilizing the module, which is a place where you can put in your roster, and then it'll allow you to kind of track all of the immunizations in one place. So you don't have to have all of the CISs and be able to like look at them and know what they say. It'll keep all of that information in one place for you. If you're utilizing the school module piece, which it will also walk you through, there's trainings and everything on there. It's fairly self-explanatory. You don't have to report because they'll just suck the information out of the backside. So then therefore we'll just kind of, it's like a bonus, as I always say for people. Okay, so I'm looking at the time and I want to make sure that I honor y'all's time as well. But before I move on to my last topic, does anybody have any questions about the registry? I'm really glad to see that there's people who are already using it. I always say my least favorite part of when I worked for ESD 113 for 10 years, and my least favorite part about being a health coordinator was being the bill collector for immunizations. So this gives me the opportunity, this really, when I had access to the registry, gave me the opportunity to not have to do that. And I'm hoping that you were able to make use of it in the same way. I'm vamping, filling time in case there's anybody who has a question. So yeah, it's fairly self-explanatory. Again, if you need help signing up, you do need a SAW account to be able to access the system. And once you have a SAW account and then you sign up, then you're able to access the immunizations for any of the children in your care. Or children who are signed up to enter your care. So you can help families as they're enrolling in your program. Okay, I'm gonna move on to my oh, Colleen, you're coming off, you just coming on. Okay, I just want to make sure I'm giving everybody the opportunity to talk if they need to or want to. All right, so my last thing that I wanted to talk about is lead in drinking water. And we have, for the last 18 months, been running a pilot through an EPA grant with the Department of Health to test drinking water in childcare centers and childcare locations, because family homes as well as centers are both eligible for this. But it tests for free, because as for anybody who has had to pay for it, you know that it's not necessarily an inexpensive thing to do. But they will test for you. And because it's an EPA grant, we have a little bit of money to help with remediation if there's a problem. One of the things that we know, and this is one of the holdovers in the way our WACs are written, and this is part of what's been fantastic about the way that we've been able to run this grant, is that the WACs are written from the perspective of what we knew 15 to 20 years ago, which was that the thinking that if there's lead in the water, it's coming from the system. I mean, think Flint, right? Like it's coming from the water system at large, or it's coming from all the pipes in your house. What we know now is that's actually not the case, especially not in our area. And so what we know in our area is that if there is water in lead, or lead in your water rather, it's every opportunity that we have tested over the last 18 months. I won't say any percentage because I would be making it up, but every one of the centers that we have tested over the last year that has tested high, it's been a fixture, meaning it's been a faucet or a water fountain or some sort of the thing that sticks out of the wall is the part that has the lead. And that comes from the actual fixture itself and how it's created, or the solder for how it's put together. So we have, I don't unfortunately have a number of how many centers have tested. I know how many have tested positive because those are the ones that I am involved with. And out of over the last 18 months, we've had about 75 centers or locations that have tested positive. Of those, only about 5 actually had things that had to be replaced or repaired. The vast majority of them, it had to do with, and this is such an odd thing about the time that we were living in, were classrooms that had been closed for long periods of time. And so water was sitting in the pipes and in the fixtures, and they hadn't been flushed appropriately. So then when the retesting happens with support from the Department of Health, they've gone back and been able to clear that high based off of the idea that they actually were utilizing the fountains now, or the water fixtures. So I want to, again, really quickly show you the website, and I will put the link in the chat so that you can access it or tell people about it that you may have around in your area. So this is the lead and childcare drinking water page, at Department of Health. And right here is register for our free lead and copper water testing program. The reason that I'm bringing this to you right now is that, as we all know, the federal system right now is in a bit of transition. And we know that we have money in our EPA grant right now. So for anyone who is in the window of needing to have your water tested, even if you're a year out, I would recommend doing it now. It's not going to hurt you to do it early, and you'll have the support to be able to make that happen. Oh, perfect. Thank you, Hannah. Can the water, are you talking about the water testing? Can it offer support in multiple languages? We have all of the printed materials printed in English, Spanish, and Somali, the same way we do all of our other childcare work. There are not any speakers of any of those languages in the office, but all of the materials that go out can go that way. And when we have had a few that have tested positive that needed support, we were able to get some translation for the written materials, you know, because the email that goes out that says this is what happened, right? Because most of them, they're going to come in and say, everything's fine, here's your letter, provide it to your licensor, you've now met the requirement for the WAC. If it has a positive finding, then what's been happening is that I will then, the Department of Health will send that information to me as well as to the child care provider. And I will let the licensor know, hey, this tested positive. They're part of the center, you know, they're part of this program. They don't need to close their center. They've marked this faucet, this fixture as out of use until we're able to fix it, whether it's a retest and discover that it's fine or the fixture itself has been replaced. And then we just kind of can go about our business. And so those emails, like I speak Spanish, so I can do that with the Spanish speaker. But if it's a Somali speaker, we've had to kind of pull in some support for those. But we actually haven't had any of those test positive. Anybody who wasn't able to use the English and the limited translation. I'm sorry, there's like a helicopter flying by my house. I feel like I don't know. Anyway, so that's kind of where we're sitting with that. And it is a fantastic program. I highly encourage that if you're in your window, go for it. Oh, good. Perfect. Thank you, Astrid. Sounds like she's got an update as well about this. So I put the link in the chat and I have just a couple minutes. So is there anybody else who has a question about this or any of the other things or anything broadly about health kind of things? We used to have a health get together, which kind of lasted for about 2 years post-COVID, where many of you, I had the opportunity to interact with you on a fairly regular basis, but we kind of sunsetted that and so I just want you to know that I am here as a resource if that comes up, as far as if you don't have one today, but perfect. Yes. Okay. That's it for me. I'll put my contact information in, and if there's anything that comes up, please feel free to get a hold of me.
Thank you, Jennifer, for all that information and sharing this presentation. I just wanted to alert folks to the link in the chat for Menti for feedback and insights on this presentation. This helps the ELAC Executive Committee for planning future meetings and just knowing what's relevant for folks. And then just one little side note, I did click the link to sign up for this. I'm also a childcare provider. And in the link, when you're signing up to receive this, you can indicate that you would like an interpreter of a different language. So you can just check it right in there and you can specify the language, which I think is really proactive for folks trying to sign up. While the form itself is just in English, which can be a challenge, at least there is the option to indicate that you need translation in another language, which I appreciate seeing there. And then after folks are done with the Menti, I'm going to pass it over to Hannah for the next section of our meeting.
Thank you, Colleen and Jennifer, for that great health information. I found it really informative, and I think that a lot of our early learning professionals will as well. Just as a reminder, as we move into our next presentation, if you have questions, type them into the chat, or if you have comments, we can address them in that way. Give it a few more minutes for y'all to share feedback. At this time, we'd like to welcome Government Affairs Policy Advisor Courtney Parker and the Assistant Secretary of Early Learning, Nicole Rose, who will provide an update on the early learning legislation. And that's also going to include the key policy updates, budget considerations, and potential impacts on early learning programs.
Thanks, Hannah. Like Hannah said, I'm Courtney. I'm a policy advisor within the government affairs team here at DCYF. I'm here with Nicole. Ruben is here as well today, so he will be able to jump in at any point on this presentation. And we are here today to provide a high-level update going over the end of the legislative session, early learning bills that passed the legislature and were signed by the governor, and an overview of the budget realities. Nicole, is there anything you want to say at this point?
I think that's it, and just appreciate Courtney walking us through what has passed this session, and then we'll dig into, as she talked about, the budget realities and where we go from here.
Thank you. We can go ahead and go to the next slide. Thanks. Now, this is a timeline overview that is familiar to a lot of folks, but is helpful for understanding the intersection between different processes and roles. So right now, as we enter June, we are in the phase where a session has ended, the governor has signed bills and put forth a budget, and state agencies are shifting towards implementation or to implementation. And I also just want to recognize here that this timeline shows the ongoing and really cyclical work that's underway. And this helps for recognizing that the purpose of this presentation is really to provide information on the action that the legislature took. And we are not able to speak in great detail about the impacts of changes and implementation at this very moment, as we are currently engaging in that initial implementation work. So we cannot provide or do not yet have that level of detail, while also recognizing there are those implementation questions at this moment, and those will be addressed as plans are developed and communications are going out with impacts. So we can go ahead and go to the next slide. I also want to just touch on a couple of realities that are shaping things. So first, foundationally, this was a long session. It was year one of a biennial session, so the session that sets the budget for the next 2 years, meaning the operating budget that goes into effect on July 1st. We also have a new governor for the first time in 12 years. There was significant lawmaker change with some new policy chairs, new members across both chambers. We have our new secretary here at DCYF. So all of that just impacts dynamics and the reality of things. Then there is the humbling, sobering, very layered budget reality that our state is facing and touches all of our work and all of our lives. With spending outpacing revenues, the legislature had to make very difficult choices around how to balance the budget, including a mix of service and program delays, reductions, and eliminations, as well as the legislature responding in areas necessary with new investments and revenue generation. And we see this multi-pronged and challenging approach taken throughout DCYF programs. So that is a lot of preliminary information, and we're going to shift to an overview of the bills that passed the legislature and were signed by the governor in the early learning space. But I also want to pause right here for any questions or any other thoughts from Nicole or Ruben. All right. I'm not hearing anything. I'm not seeing any hands, so I'll go ahead and keep moving to the bills. So this first full slide starts with House Bill 1351. This bill, as well as a portion of Senate Bill 5752, clarify and adjust ECAP entitlement and ECAP eligibility, meaning the bill is largely technical changes and provides more clarity in statute. So particularly that those turning 3 after the August 31st cutoff date can enroll in ECAP and are not considered as part of the entitlement. So really creating some efficiency and increasing a bit of access to more families. The next bill, House Bill 1648, This bill modifies childcare staff qualification requirements and does a couple notable things. First, it delays the timeline for providers to meet these requirements. It also adjusts the length of the experience-based competency demonstration pathway. And then it creates a work group for the department to continue the conversation with providers about how to build out those necessary supports to meet staff qualifications. And it looks ahead to strategies for improving the staff verification process. And then the bill directs the department to report to the legislature on these strategies by December of 2026. Then we have Senate Bill 5030, which expands the type of document and record that are allowed to verify birth date or the age of a child for enrollment, and this applies to ECAP and then the broader K-12 system. Next, we have Senate Bill 5263, which is concerning special education funding, and this bill contemplates the special education delivery system in the K-12 system. And included in that is an increase to the cost multiplier for the early support for infants and toddlers, or ESIP program. And Lois, I see your question and I can pause right here and let Nicole answer that one if you'd like to, Nicole.
Yeah, thanks, Lois. So we're working on a follow-up email that we can send out to provider supports, and we could send it out to this group as well. That's a survey around who might be interested. And the other thing that the group was doing was also looking at who was named in legislation and the process to reach out to those orgs to have them decide what individuals they would like to have on that work group. One of the things I'll just share that we heard at provider supports is really making sure as we look at the work group makeup that there is good representation across provider types. And the other thing I would just share is as we do a work group, one of the things we'll be working through is what is the feedback loop that happens with both the Early Learning Advisory Committee and provider supports as well. So that was probably a really long way of answering. There'll be an email coming out soon to begin recruiting sort of beyond what was named in the legislation. And then we're working through the process of how we contact those orgs that were named to see who they would like to have participate.
Thanks, Nicole. And I just put the bill in the chat for people's reference as well. And Susan, I see your hand up. Would you like to go ahead and ask your question?
Yeah, I just wanted to reiterate to the DCYF staff the importance of making sure that there is a majority of providers on that work group, because we are the only ones who actually have to live with the rules that are determined. I've shared this at provider supports and provider supports and other meetings. We do not need or want it to be a majority of non-caregivers. Like, it shouldn't be mostly SEIU, childcare, or all those other people that don't do the work. That should not be, they should not be the people that are the majority of the committee. And I wanted to put that out there today for the record.
Thank you, Susan. Okay, I'm going to move on to the next bill as well, which is Senate Bill, unless anyone else has questions at this moment. All right, I'm going to go ahead and move on to Senate Bill 5769, which puts transition to kindergarten programs on pause from growth by capping enrollment for the next school year. The legislature also directs OSPI and DCYF to work on some planning and phasing of the programs with certain considerations for the entire statewide early learning system and landscape, with a report due in December of 2027. Lastly, on this slide, we have Senate Bill 5752, and this bill makes a number of modifications to early learning programs, and Nicole will touch on this during the funding pieces in the budget overview. but what this bill also does is clarify the ECAP entitlement definition. It requires the Department for Compliance with Child Care Development Fund requirements to write rules and increase the frequency of the market rate survey and cost of quality study. And it directs the department to conduct a pilot for licensing school age care in partnership with a local municipality. So some policy pieces and some funding pieces are included here. We can go ahead and move to the next slide. Thank you. So the second set of bills includes those that involve more aspects of licensing and reducing barriers to facility operations for providers. So starting with House Bill 1314, this makes updates and modifications to the Early Learning Facilities Fund program, which is administered in partnership with DCYF, but through the Department of Commerce. Next, we have Senate Bill 5509, which requires cities and towns to allow childcare centers as outright permitted uses in most zones, while cities may impose reasonable restrictions on the permit. Next, we have Senate Bill 5545, and this bill exempts off-base family home childcare providers on or near military bases from state licensing if they are overseen and certified by a federal military service. And DCYF still retains CPS investigative oversight here. So thank you, Rep. Levitt, for referencing those two bills earlier. And then we have Senate Bill 5655, which provides clarity for calculating occupancy loads for childcare centers within an existing building by stating that building officials must calculate the occupancy load based only on the area in the building where childcare services are being provided. So that covers the bills in the early learning space that passed the legislature and were signed by the governor. And I'm going to turn it over to Nicole now for a high-level overview of the conference budget, but I want to pause again here for any questions, comments, or a moment for Nicole and Ruben to jump in as well. Yeah, Sandra.
Good morning. On the House Bill 1351, which changes the age requirement for ECAP, that goes into effect July 1st.
Let me look it up really quick if it's July 1st or July 27th.
Okay.
And I think, Sandra, what I would say too about the that bill is as that goes into effect on either the 1st or the 27th, it really is saying as space is available, children who turn 3 throughout the school year could be enrolled, but that ECAP really still needs to prioritize 4-year-olds who are 4 by August 31st and 3-year-olds who are 3 by August 31st of that school year.
Okay.
And Sandra, I just put it in the chat, but the effective date for House Bill 1351 is July 1st. All right, I think we can go ahead and move to the next slide. Thank you.
Thanks, Courtney. And I just want to give a big thanks to Courtney for walking us through that, and additionally, all of her support to our teams across early learning, licensing, and others during legislative session. There was a lot of work that occurred, and so just very appreciative of her leadership in that area. So I'm going to walk us through some of the budget realities. And as we do this, I just want to pause for a moment and acknowledge all of the work that you all do every day to provide high quality services to kids and families, and just reiterate that as we walk through where we have landed in the state budget for this year, that Washington State and DCYF are still really committed to continuing to build out the early learning system so that all children and families have access to high quality care. It may just take us a bit longer to get there, but there still is that long-term commitment. So if we want to go to the next slide, I will start orienting you a little bit to what you're going to see as we walk through the budget. And this is a pretty dense set of slides that we're going to go through. So I'll take some pauses to see if there are questions along the way. What I first want to orient you to is that if you see something a number that is written in black, that means that it is an increase. And if you see something that is in red, that is an assumed savings. And that savings might have been assumed by either reducing funding or delaying or pausing something. So just wanted you all to know that's a little bit about what you're going to see as we work through this. So the first pieces that we are looking at here are related to Working Connections childcare rates, the collective bargaining agreement with our licensed family home providers and family friend and neighbor providers, and then coming into compliance with the Child Care and Development Fund. In the first item, what we're really looking at is the center-based rates. And what is going to occur here is that for centers, there is a delay to the base rate increase to the 85th percentile of the market rate by 1 year until July 1 of 2026. When that rate increase goes into effect on July 1, 2026, there are some savings that are achieved by removing the hold harmless for a subset of providers that have current subsidy rates that exceed the 85th percentile of the market rate survey starting in FY27. So just for illustrative purposes, if as a provider, your subsidy rate right now was $50, and the market rate survey said that subsidy rate is actually $45, you would, when that rate changes, be going to $45. So there's an assumed cost savings there. The collective bargaining agreement that you are seeing right here really is a roll-up of all of the things that were bargained by SEIU 925 on behalf of licensed family child care providers and family friend and neighbor providers. So that includes subsidy rates for both groups. And this also does include some places where you see funding greatly reduced in some areas or not appropriated. Some of that's because it was rolled into the collective bargaining agreement. Trauma-informed care is a good example of that. The final thing we have on this slide is coming into compliance with the Child Care and Development Fund pieces, which are really a great step towards bringing our practices related to child care subsidy closer to the private market, where we are paying providers prospectively, so as close to the beginning of care as possible, and then based on enrollment, which is something that we did during a couple of years during COVID. And in this, we would also not be pursuing overpayments. So that's some of the Working Connections rates and compliance pieces that were funded. If we want to go to the next slide. I'm going to start walking through several slides that have a lot of red on them. And so we're going to go through this together. I will pause at the end of each slide to see if there are questions. Again, this is where you see a combination of some delays, pauses, or actual reductions. And I think one of the things that I'll note is that as we look at the delays in some of these pieces, there really still is acknowledgement to what was in the Fair Start for Kids Act and continuing to move towards those pieces, as I said earlier, just at a slower pace than we had anticipated due to the state budget. So the first piece we see in here is a delay in the eligibility expansion to 75% of the state median income for child care subsidy. So that will be delayed until July 1 of 2029. The next couple of pieces in here are sometimes what we call expanded eligibility in childcare. And this is where there was some expansion in eligibility for particular groups and sometimes a zero copayment or some of those pieces. Childcare employee eligibility and registered apprenticeship eligibility is removed when this goes into effect. Now, employees who are still eligible under regular working connections after July 1, they could still apply and be eligible under regular working connections. Childcare employees and folks who are registered apprenticeships who are participating in that could still apply under these rules through the end of June. July 1, anyone who applies will need to meet our regular working connections childcare eligibility rules. Sometimes when we are forecasting around new eligibility groups, our assumptions about the number of families who are going to take us up on accessing that particular eligibility might be a little bit off. And that's what we're seeing with the student parents eligibility. There's some savings captured just to reflect an underutilization in this particular expanded eligibility category. There was a lot of conversation about family co-payments during this legislative session, and part of what we saw was conversation about child level and family level co-payments. What I want to say is that co-payments do not change for this coming year. Co-payments will change starting October 1, 2026. And then during that time, it will still be a family level co-payment, but it will be based on a percentage as we move into that October 1, 2026 co-payment change. All of these things were part of 5752, and you're just seeing the savings steps noted here. The next thing we have on here is 12-month eligibility determination. And this is where some savings were assumed by adjusting the authorization and the eligibility period. Right now, authorization and eligibility are really tightly connected in some respects, and my 12 months of eligibility. So I'll give a concrete example of that. So if I go and apply for childcare right now, let's say I've applied on June 3rd, but I don't find a provider until July 15th. As it exists right now in current law, my 12 months of access to care would run July 15th through June 30th, 2026. So as soon as I found that provider, that's when my 12 months would begin. What this is doing is saying, I went and applied on June 3rd for childcare, and I didn't find a provider until July 15th, but my 12 months of eligibility for care begins on June 3rd, and it will now run through May 30th of 2026. So a little bit of change around how that 12-month period works. And then what we see with ECAP entitlement, there are other pieces related to ECAP that we will talk through, but entitlement is delayed to 2030-31 for all children defined as entitled who choose to participate. I'm going to pause there. I don't see any questions in the chat, but want to make space if there are questions on this slide before we go to the next slide. Okay. Let's go to the next slide. On this, we're really talking about ECAP, our Early Childhood Education and Assistance Program, and ECLIPSE, which is our therapeutic care that is layered on top of ECAP. So as we look at these pieces, you see a mixture of both some increases in funding in some spaces and some reductions in others. So the first thing we see is ECAP rates. So there was a 5% rate increase for school day slots beginning July 1 of 2025, which is fiscal year 26. The next thing that we see on here is an ECAP slot reduction. So we need to reduce ECAP by 3,000 part day slots beginning in fiscal year 26, which is July 1, 2025. I will say that the team is engaged in that process right now and having conversations with contractors about what that looks like. One of the things that I also want to note is we were under contracted this year on the number of contracted slots that went out to providers and also had some under enrollment in the slots that were contracted out as well. I want to acknowledge, though, it is challenging and difficult to remove ECAP slots when we know that kids need access to care. And so we'll need to be thinking about what are the other things that children and families might potentially be eligible for, or what might be in their community. When we look at a slot reduction like that, which is 3,000 slots, one thing to also know is that that also reduces the administrative rate at the department to oversee the program. So that means that there are FTE reductions at DCYF that need to occur to achieve this savings. And I'll talk a little bit more about that when we get to the end, because there are other places where that has occurred as well. In the next school year or fiscal year, so not the one that's coming up, but the one after this. So if we get to 26-27 school year or fiscal year 27, there will be an increase of 250 school day slots. The next thing that we have on here are some reductions that were related to some projected underspend. So the first is the ECAP Complex Needs Fund. There was a reduction based on some projected underspend. I do also want to note that there had also been one-time funds in the ECAP Complex Need. So that funding has been removed, as well as a reduction in the funding moving forward. And then on the Early Childhood Intervention and Prevention Services, or ECLIPS, there was a reduction in funding based on a projected underspend as well. I want to pause there and see if there are any questions about this slide. Okay. I'm going to have us move to the next slide. So we're going to continue talking about some program reductions and eliminations. So some of the items that you see on here were some rates and enhancements that came about from the Fair Start for Kids Act. The first item is trauma-informed care. On this, there was a reduction to trauma-informed care, and in fact, it was eliminated for center-based providers and retained for family child care. And you see that funding in the collective bargaining agreement. The next item is dual language designation. There was a reduction in funding for the dual language rate enhancement for center-based providers, and the amounts that were bargained in the collective bargaining agreement for family child care remain intact. The next item on here is early ECAP. And as we went through session, there were a couple of different iterations around how the bill looked related to this. In some of the first iterations of the bill, the actual RCW that allows the program to occur was repealed. But in the final version that passed, that RCW remains intact and early ECAP was subject to appropriation. And it was the funding for the program was eliminated, but they left, like I said, the underlying RCW in there. And so contractors are being notified of that as well. And then finally, we have a Working Connections seasonal childcare savings. And this is achieved by removing this proviso that was connected to seasonal childcare, as families who may have been previously eligible under seasonal childcare are actually eligible for regular Working Connections childcare. I want to acknowledge I've just read through a couple of slides that are related to funding reductions that I know providers have depended upon, have helped support the children that you're caring for. And I'll also say, as we went out and had the community childcare conversations, really heard from providers about how some of these rates and enhancements were assisting them. As we move forward with these, it likely means we'll need to look a little bit differently about how we roll out those rates and enhancements. Instead of opening them up to all providers, we may need to look at particular areas where we might be able to prioritize or focus those resources. The other thing I just want to acknowledge before we move to the next slide is, as you look at some of these reductions or delays, that for some of our providers, there may have been multiple of these funding streams that were being accessed. And that also for our contracted providers, there may be multiple funding streams that they were accessing. And so there are reductions out to our contractors, which I know also have impacts. And so, you know, we're navigating through the impacts, potential impacts on children and families, potential impacts on staff, and you know, just trying to really look at how do we get the most dollars that remain out the door to get services to children and families. And if we want to go to the next slide. So I'm going to talk through a few of the other reductions, and Lois, I want to note that I see your question in there, and I will come back to that in a moment. So here are some additional reductions that occurred. And these, again, are related in some instances to where there was projected underspend, but in other places where there had been some enhancements or expansion of items through the Fair Start for Kids Act. So the first item is equity grants. And this is a reduction of funding by 50% for equity grants. And so there'll be funding available for center-based providers and for family child care providers. The Child Care Complex Needs Fund was reduced by $5 million. And in the Early Learning Facilities Technical Assistance Fund, and this dollar amount I'm talking about here is funded out of the operating budget. We'll talk a little bit more about the ELF funds that are funded out of the capital budget in a moment. There was funding reduced by assuming some underspend in that space. For facilitated play and learn groups, under the Fair Start for Kids Act, there had been an expansion of some of the supports and services here. And so what you see is a reduction of that expansion. In some respects, this is similar to what we see in the infant and early childhood mental health consultation space. We have worked hard to grow access to infant and early childhood mental health consultation. And as we look at this line item, there was some reduction in funding for infant early childhood mental health consultation, but does preserve a base level of services out in our communities and regions. Tribal mental health consultation was also reduced as they looked at some assumed underspend in that program. If we want to go, I'll pause here and see if there are questions. And I think, Lois, I see your question here about parity between homes and centers. And I think what we're seeing is a really challenging budget where there was a collective bargaining agreement that was in place and a commitment to honor that collective bargaining agreement and to try and get funds to centers as quickly as possible and is in the best way possible. And I would have to ask the legislature to speak to sort of their decision-making process as they navigated through what were, I'm sure, extremely tough decisions as we faced this large budget deficit. So if we want to go to the next slide, I'm going to talk a little bit about new investments, and then I want to come back to some of the funding reality and what this means. There were some new investments that were made, as well as some vetoes as well. So Washington Communities for Children, there was $2 million added for services to Washington Communities for Children and to continue that contract. There had been a proviso to do a child care mental health pilot program in Spokane, and that was vetoed due to lack of resources to implement that. And then what we see finally on the capital budget side is a commitment to the Early Learning Facilities Fund, where there was money funded in the ELF grant and loan program, money funded for minor renovations, and money for emergency grants. This does also have a portion of funding that can go to DCYF to continue the technical assistance, some of the pre-licensing supports and other things that this was funding. So I believe this is the last slide. And then I'm going to, oh, one more, I apologize. And then I'm going to turn to the questions in the chat and share a couple of other pieces. One of the things that we have also heard from providers about is the just what is happening with insurance coverage. And we are seeing that not only in our child care centers, but in our group foster homes and other places. And so the Office of the Insurance Commissioner has funding to study a feasibility of doing a joint underwriting association. And Emily Arneson at DCYF is really coordinating that effort with the Office of the Insurance Commissioner, working closely with Ruben. I want to give Ruben a chance to weigh in if there's anything he wants to say about the Insurance Commissioner study before I turn back to a couple of other pieces.
Thanks, Nicole. And so the Insurance Commissioner will be reaching out to DCYF and will be asking for providers information as they do this feasibility study. Right now, they are in a procurement to choose a vendor to do the feasibility study, and we are assured that they will be reaching out to hear stories from providers of how insurance liability is impacting them during this study. So you will hear from us. We want to hear from you, and the Office of Insurance Commissioners will definitely be in contact with us.
I think if we can pull down the slides, if that's truly the end, I think that would be helpful, just as we have a little bit more dialogue here. I know I just read through 4 slides of some painful reductions, delays, and pauses. And I just want to recognize and to thank you all for all that you do and that you bring to early learning. And I want you to hear that we are committed to continuing to support providers, to continue looking at how we are making it so that all children and families have access to high quality childcare, and that we continue to look at how we can increase rates and those pieces. We are in a situation where state funding is at a budget deficit, and I know that things at the federal level are a bit tenuous as well. But I am confident that there will be funding again at some point, and that when there is, that we will be ready with a plan to move forward around how we can best support you all in doing this incredible work. You are the ones caring for our children every day. You are creating environments that are safe, loving, high quality, and please just know that you have our deep gratitude for what you do. The other thing I want to also share, because I think it's important to know, as I talked about some of the funding pieces, is, as I look around the collective early learning advisory committee room, I see many of you who we contract with, many of you who are providing care on a daily basis. And I know that as I talked through those funding streams, that it wasn't just one funding stream that you may be working with. And so I understand that there are some real implications with that. And that sometimes that has meant reductions in force, or it may mean other tough decisions. As I talked through some of those programmatic pieces, I shared in ECAP in particular that funding was tied in some respects to how we could fund our FTEs. There are a couple of other places where there was FTE reduction, where our FTE, what they call our FTE authority, was actually removed. And yet other places where the funding was reduced so much that that has an impact on staffing. And then as an agency, and as many state agencies, we were asked to look at administrative efficiencies, and some of that is related to funding. I want to share the impact with you in the early learning division, just because I think it's important to know, and we're going to come back and talk about what it means moving forward as we navigate through this process. So through this, the early learning division had to eliminate 17 positions as part of a reduction in force. And so that means that 13 of those positions were filled and 4 of those positions were vacant. One of the things about working for the state is through the collective bargaining agreement and contract, HR has really followed that process and has identified, options for those impacted employees. But what that means is that, again, the way we do things may need to look a little bit different. And so I just want you to be aware of that as we navigate through this together. But I do commit to coming back and talking with you about what that means, because that doesn't always mean that the work went away. It just may live in a different place. Laura, I see your hand up.
I just wanted to mention that since centers didn't get rate increases this time, right, that I hope that DCYF will keep us in mind in their legislative priorities in the future, because we really need more funding to be sustainable, and many of these cuts will really impact the majority of the kids in child care centers across the state. Thank you.
Yeah, thank you, Laura, for that. And I think that's a good, it is a good reminder about the realities that we're in. And I know as I am talking with you all here in June, that we're going to be talking with you soon about decision packages for supplemental session. And historically, we have come and we have really talked about some pretty big asks, and that's going to look a little bit different this year. And so I just want to put that out there. We will come and talk with you about what that looks like, but it's going to look a little bit different than it has in years past. There are some other, so I'm just trying to go through the chat here. There are some questions about given that the pass to move to cost of quality care reimbursement versus market rate reimbursement didn't pass, what are the next steps in that effort? One of the things that did pass was a requirement for DCYF to do a cost of quality care study and a market rate survey every 2 years. So I think there's some good in that it is in legislation now that we need to do the cost of quality care study. And so we'll continue to do those studies. And then what we'll do is we put those forward as how we set rates, and we put those forward through our decision package process. When we can do so, that wouldn't be a supplemental ask, but then we would follow the same processes, that we follow to access funding. I shared a little bit earlier with the executive committee that, as an agency, one of the things that we're really looking at is how can we look at what was in Fair Start for Kids Act and really look at some of those things that have been pushed out and say, this is really the first order of operations. And I also think that as we've talked here before, we know that increasing rates and increasing family eligibility helps us increase access to care. And so we'll be committed to continuing to look at those two things when funding allows us to make those types of requests. And I do want to acknowledge that how often and when we can make those requests are likely going to be subject to the state budget forecast and what that looks like. Brian, I'm looking at your comments that I think some are better for others to respond to. And then I'm happy to talk about, and I'm going to welcome Deanne to join me in talking about this specifically as well, around the mental health consultation being offered at sites and what that might look like. Before I do that though, as we talked about some of these pieces that were decreased, I think one of the things I want to note is what is still there. And we still have coaching in early achievers. We still have a commitment to increasing rates. It's not as quickly as we would like, but there are still some really strong foundational pieces to the system there. When we look at the mental health consultation that is being offered, there had been a pretty significant expansion of those services. And I think in talking with Child Care Aware, who is the implementing partner of that work, I think there's a strong commitment to ensuring that there is a base level of services that's available in each region, as well as the bilingual mental health consultant that is at the state office. I think this is also a time where we're going to need to really, Ruben talked about sharing stories around how the insurance pieces have had an impact. And I think this is a time where we're going to really want to be able to tell the story of the need related to these items and the impact if you are or are not able to access them. But Deanne, I just want to offer, if you would like, if there's anything more you want to say about mental health consultation. And then Brian, I'm actually not sure I answered your question. I want to make sure if you're asking if there are delays happening right now, but I'll let Deanne speak. And then if you can elaborate, that would be great.
Thanks, Nicole. Yeah, so essentially we are moving from 26 IECMHCs out in the field to 13. So half of the half the number we had built up to. And so we are really looking at, which has created a lot of knowledge about IECMHC versus when we were smaller. So of course there's more demand. But what we're doing is we're looking at retooling to try to spread as much support as we possibly can. And one of the ways that we're looking at doing that is having open office hours for providers and coaches separately, to just do some problem solving where we offer it statewide instead of each region having their own sort of lane. We're looking at how do we expand this availability using the 13 folks that we have to do some office hours that create capacity. We're finding that a lot of providers call when they are just at their wits' end and they need somebody in that moment. And so we're really working hard to say, how do we pull this off? What might that look like? That said, we don't want to lose sight of the importance of really doing more than just bandaging a challenge, but rather diving deep to get at the root causes and provide the support that the child care program might need to really make the change to meet the needs, the long-term needs of a child and for all the children in the program. And so we will continue to offer in regions our traditional mental health consultation for programs that really need that deeper dive. Obviously, we will not be able to meet all of the needs, but we will do our best to make, as much of an impact as we possibly can. And then the other thing that we are really thinking about doing is helping coaches to build their skill set even more around meeting sort of some of the more basic needs that really don't require the mental health consultation, but some of the earlier interventions that could happen at the ground level, given that coaches are in programs across the state. How do we maximize our use there? What's the appropriate use of that resource? Because we know that quality only happens when people are in socially, emotionally healthy spaces. So it is really part of our quality work when you think about the whole picture. So we're really looking at trying to do that. As we get clearer about all of those things, we will be creating communication, brochures, all sorts of materials to really push out so that it gets really clear how to access the services that are continuing. Because we know that because of the up and down of the ledge session, a lot of people don't know that there's going to continue to be this resource, and we want to make sure and get the word out about that. But over the next month, we really are working at retooling and working with those that have been working in the field for a good long while to make sure that we're thinking it through well and pushing out something that would really work. So hopefully that answers questions. I'm always available. If you have follow-up questions, you can reach out directly to me. Happy to answer any of those.
Thanks, Deanne. And I see some questions in here about, with Secretary Sun's leadership, how will advocacy and strategy be different? One of the things I'll note is that, DCYF is still committed to the things that we've been committed to, including increasing eligibility, increasing rates, the things that were lined out in the Fair Start for Kids Act, and the items that we heard from you all about as we think about the access and living wage plan. And so the path forward is out there. The funding is the place where there are some challenges right now. As far as the advocacy piece, Debbie, as state agencies, we don't advocate, and I would encourage you to talk with others who do that work. But I think, as we think about, again, the early learning community, there are many folks who have come together, including people here, around what does that plan look like as we continue to work towards a universal early care and education system. And so going back to families paying no more than 7% of their income, providers receiving a living wage. And so there's been a lot of work done on that, that, like I said, charts the path forward, and we need to keep our eye on that and really continue to have that be the foundation of our asks moving forward.
And if there's nothing else, I think we should stop there and take about a 4-minute break. We will be back at noon. Thank you, everyone.
Thank you.
Reminder to put your reflections into the Menti for that presentation as we move throughout. You can do that when you're on your break or when you get back. Thank you all.
Hi, everyone. Welcome back. Apologize for the short break. Hopefully you all got to enjoy it. Just a reminder that the Menti will be open for the rest of the meeting, and to please type all your questions in or your comments in there, reflections. Anyway, we would like to welcome Ruben Reeves, Assistant Secretary of Licensing, and Nicole Rose, Assistant Secretary of Early Learning, and Debbie Goff, DCYF's Child Care Deputy Senior Administrator, as they share a summary of the 2024 Child or Community Child Care Conversation, highlighting key themes, trends, and next steps, and provide an update on the 2025 session.
Thanks, Tanya. So good afternoon. We're just, Nicole and I wanted to just provide a brief overview. We did it in the provider supports. We want to do it here with ELAC. Just a quick overview. I know a few weeks ago, several of you received the final report that came out of the 2024 community child care forums that were conducted. We did about, I think about 9. 8 in person and 1 virtual, and we learned a lot, and it was great discussion. And in this report, we just captured some overall themes that came out, and then also some kind of action steps that we want to take this next year, part of those improvement areas. So next slide, please. So I'm going to start with some of the licensing division, just high level. And again, I know that you guys have received the report, and happy to see Travis Hansen, his first ELAC meeting coming back. So he has hopped on. So Debbie's not here, but Travis will also help me kind of talk about some of the action steps and that we're taking on some of the themes. So one of them was WACs, right? And interpretation of WACs, being consistent with our rules across the state. And so in the report, it highlighted some of the things that we're doing, which is all of our child care licensing staff receiving WAC training as part of the 6-month onboarding training plan. We have an internal review committee that, as you know, when someone asks for internal review, we have a group of supervisors and staff that really look at that, whether it's a citation or a waiver, to make sure that we are interpreting the WAC and enforcing the WAC on a consistent basis. We have our collaborative compliance and strength-based approach, right? And we do this not only with our 6,300 licensed child care providers, but a lot of our providers that we work with in licensing division, really having that strength-based approach and that collaborative compliance. And then we also wanted to highlight, rulemaking. We need to do a better job in DCYF to make sure when we are revising our rules or revising our WACs, we get it in front of the providers earlier, right? And partner around that. And so we are committed to that, to have better communication around that. Travis, anything else you want to add on the WACs and being consistent on the WACs?
No, I think you nailed it. We're committed to this. Yeah, I think you nailed it.
Okay. And we talked about, like I said, the continued collaboration. We are going to be continuing the child care discussions. We did have our hiring freeze and our travel ban that kind of put us on pause having in-person meetings, but we've had a few virtual ones across the state, and we are committed once the travel ban is lifted to have those in-person child care discussions again. We want to strengthen and have those meetings that I think are very helpful for our provider community, and meeting with the licensors and meeting with supervisors and meeting with administrators in that region, and talk about different things. Just talk about WACs, talk about how we interpret them, how we enforce them. So we will continue those conversations, and hopefully they'll be in person soon, but we will have some virtual ones sprinkled in there as well. And then Nicole and I already talked about the insurance. That definitely came up in 2024 as a concern. Like I said, it's not only concern in childcare, it's a concern with a lot of our providers that care for children in Washington State. So we are excited to work with the Office of Insurance and have that feasibility study and just kind of see where it goes from there. And we want to advocate for you on behalf of the provider community around this, and understand that it is a concern, and we want to make sure that we reach out to you, and like I said before, and so you can tell your story. And I believe those were just kind of the highlights. Again, the full report came out a few weeks ago, but any questions regarding the the key actions on licensing division. Okay, I'll hand it off to you, Nicole.
Thank you. Oh, you have one more.
Oh, I have one more. I'm so sorry.
And Laura has her hand up as well.
Okay. Lois, when will the insurance work group begin? Right now they are, there's a procurement right now to do the feasibility study. So once that they get a vendor, so let me get back to you on Lois of actually when they'll hire a vendor and get going on that, and I'll reach out to Emily for some exact dates. Laura, do you have a question?
I just was wondering if you could explain what the 6-month work group would look like. Like, is that going to be a recorded training that'll be consistent across the state, or each region's going to do their own? Because still in the field, we hear a lot of inconsistencies. Like, I just heard of a provider that was written up for serving refried beans. Apparently, she's supposed to notify, even though it was on her menu, the parents in writing because of fat content. And, you know, the comments from other providers are that nobody's ever heard of that. So I really think we need some consistency on training licensors. And I don't know if that could be done with video training or something like that. Have you guys considered anything like that?
I'll just hop in here, Ruben. Yes, we have. This is part of our commitment, is to get training out to our staff. We have a great group that helps us support with training in the licensing division. And that is partly what we're trying to do here, is to create that consistency. We're just now doing our second childcare licensing onboarding, which is we haven't had that. All of our staff have been trained in the past at the unit level, and we're doing it at a statewide level now, where every licensor will go through this training. And so it's just a commitment for the consistency piece. I hear what you're saying. We have licensors that do make mistakes out there. That's why we have the review process to bring the supervisor in to review it, to look at those things if licensors are making a mistake. And then we want to learn from those mistakes and share it with all of our staff when we have stuff like that happen. So I hope that answers your question, Laura.
Yes, thank you so much. I really appreciate that.
Yep.
Thanks, Laura. And yeah, our last one was the family home capacity waiver. That was definitely a hot topic in 2024. And we, we made some decisions and some changes around that. We are expanding it another year for those over 16, so they can look at their situation and understand the impacts of their communities that they serve. So we reached out to each of those providers. We had about 60 providers on a capacity waiver, and offering technical assistance on each of those. So it has just slowed down a little bit since 2024 on that, but I know that was a hot topic last year. All right, next slide, please. Yes, Colleen.
Yeah, Ruben, quick question on that, and I don't know that you will have an answer immediately, but maybe for the feedback loop. I just know that there was some legislation this year around, providers, like childcare centers being able to be in many different, like building codes and things like that, because there's so much difference between cities and counties and whatnot across the state. And I know that some of those childcare providers who were on capacity waivers, so they were a family home with a capacity waiver, truly want to be a center provider and make that transition, but they've been prohibited due to some of the city ordinances and other things like that. Do you see any success in the legislation that was passed that may allow some of those providers to make that transition? And if you don't know yet, that's fine too. I wanted to put that out there, that I know that was kind of a critical piece to that issue for those providers.
Yeah, thanks, Colleen. And we're still kind of diving in that. We actually have a scoping meeting soon to kind of see that. But I think it will help, Colleen, in some of the areas. You know, each county and city is different, as you guys know. So we're really hoping that this will help some of our family homes make it easier to become centers in some of these zoning requirements. So we're looking doing more of a deep dive on that and how that we'll look at that. I don't see our WACs changing it at all, Colleen. This is more kind of a dotted line, indirect, kind of working with the building codes and the fire marshal on that. But we're still looking to see what that would look like and how that help our providers. So, okay, I'm gonna hand it off to you, Nicole.
Thanks, Ruben. So as I go through these next slides, I recognize we just spent a bit of time talking about where there were some reductions or delays in funding, but there are also some places where we have received some funding. And so one of the things that we heard from you all as we did the community childcare forums was really the need to increase rates and to bring payment practices closer to the private market. And so when DCYF submitted our decision packages, we did have requests around things like increasing subsidy rates, funding to implement enrollment-based and prospective pay. Those things were funded, some on a bit of a delay. And we continue to have conversations as it relates to the special needs process and how we can continue to streamline that. So if we want to go to the next slide. We also heard about the support for complex needs. And so we will continue to offer the Herring Center training and we'll continue our Complex Needs Fund award opportunities. As I shared today, some of that may look a little bit different as the funds that we have available is a little bit less. But we'll certainly be having conversations with you all about what that could look like and have heard the need to make sure that those dollars are getting out to providers. If we can go to the next slide. So this is about more of our grants rates and enhancements. And again, as I just shared earlier, some of these have been reduced. And so we are going to want to talk about how we can implement those in the best way possible. And we will continue to update our website. I know we have a grants webpage. We have technical assistance resources and supports that are out there. But we'll continue to connect with you all about how we can share around the funding opportunities that are available. And sometimes what we also heard is how do we make sure that everyone is aware of what's happening at Commerce and the Early Learning Facilities Fund, and how are we linking you all to those things? So more to come on that. We can go to the next slide. Staff qualifications. So this is something we heard quite a bit about as we were out in the community. And as Courtney talked about, and we've had some discussion about today, 1648 has passed. That's the staff qualifications legislation that extends the timeline for meeting those education requirements. And so we'll be working on, I know the group is meeting again this afternoon around the charter of what that work will look like. Some of the things that continue to be available are monthly office hours for our childcare licensors. We have quarterly webinars for providers. And I think, you know, one of the things that we hear and will be working on as part of the staff qualifications work is how can we make the information, I think, a bit more accessible and in a way that people can really find what they need as it relates to their current role. So we will be, I think, making a commitment to come to provider supports and ELAC on a regular basis. If not live and talking with you all about things, certainly in some written updates so that you are aware of the work and conversations that are occurring related to staff qualifications. We can go to the next slide. So I just spoke a little bit about this. Part of what we also heard though was not only about our web pages, but actual access to some of the foundational training that's required in licensing. And we are working to increase the amount of training instances that are provided by our contracted training providers, really trying to think about how we can relook at some things. We heard a lot about childcare basics. So what are the things I really need to know as soon as I come onto the job? And so we'll continue to provide updates around the work that is happening in training. And I think the next slide might actually be related to merit. Yep. And I think, you know, what I would offer as we do all of the work related to the staff qualifications work group, that we actually probably group these things together. They are all very interconnected. But we'll continue to, I think we want to hear from you, in particular, as it relates to staff qualifications around how is the dashboard working so that you know where you are in that process. I know our merit team is really doing a lot of work as well to make sure that our materials and things are updated about how you can do some of the most frequent things in merit. A lot of that lives on our website, which probably goes back to the other piece around sort of making sure that that is more easily accessible and folks know what's available to them and where to find it. We want to go to the next slide. So I want to take a moment and I'll turn to Ruben and Travis to thank you all again for all that you are doing every day to serve kids and families. I really want to thank everybody who took the time to come out and come to a community childcare forum, or who takes the time to come to these meetings, or the variety of other ways that you're providing feedback. I think it has really helped us in thinking about where we need to focus some of our resources so that you can better access the things that you need to serve the children and families you're serving. But Ruben and Travis, I'll turn to you.
Yeah, thanks, Nicole. I just want to echo that as well. It really enjoyed last year meeting a lot of providers and having some great discussions. And like I said, we need to continue this. It's super important that we hear from you. And on behalf of Licensing Division, there's areas that we can definitely improve on, and we're committed to that. And just know that we will definitely continue these conversations.
I'll just echo with what Ruben said and Nicole. It was a great experience to be able to go out and talk to providers and hear them firsthand. I just look forward to more of those conversations. And I just really, really appreciate all the hard work that you all do for kids and families in our state. So thank you.
Well, thank you, DCYF team, for that update. And this is just a reminder for everybody, please take a moment to fill out the Menti and provide any feedback or insights or questions. This is really open-ended to help us guide our work. And Jessica just put the link in the chat. And I know we ended a little early, but I'm checking to see with Dre. Dre, are you there? Are you ready for the closing remarks? I believe we're ready to announce our new co-chair as well. There might be awkward silence. I might have to check if we have everyone's votes in, but let me check on that. And Dre, give me a thumbs up if you are there.
Yep, I'm here. All right.
Okay, thank you, Dre. And then Jessica, I know you sent me the latest election results. Okay, yes, I see that here I am, Amy. Yep, so we did receive no changes. So Dre, I sent you the results and you have them now.
All righty. So as we wrap up, I just want to thank everyone for their energy, their thoughtfulness, and collaboration you brought to today's meeting. I always enjoy where there's a lot of back and forth, because then I know that it was a good topic. Let's see. So as just a quick reminder, after each presentation, ELAC does drop a mentee to gauge your feedback on that specific presentation. And those do stay open so you can continue to add your thoughts even after the meeting is over. So those are always super helpful for us so we know if we're hitting the mark on what everyone finds helpful. So let me look real quick at my message. I apologize. All right. So the votes are in, and congratulations to Dr. Brian Knowles, our newly elected co-chair. We're excited to have you on board and would love for you to say a few words, if possible, to the group.
Wow. Well, thank you. I I didn't know, yeah, what was going to happen. So, yeah, I'm prepared, but I'm appreciative and just yeah, really thankful and thank you as well, Laura. Really just really good information to have. I'm excited to hit the ground running and to just be as proactive rather than reactive as we possibly can be. And so, yeah, I'm looking forward to it. Thank you all. And yeah, wow, I'm shocked. Thanks.
Thank you, Dr. Knowles. Quick reminder, our next meeting is on August 5th. So please mark your calendars. And then before you log off, don't forget to take a minute to fill out the meeting reflection survey. Your feedback, again, helps us to do better every time. Thank you again for all everyone does in your communities and for showing up today. Wishing you a great rest of your day, a great rest of your week. Thanks, y'all, for engaging and showing up.